Explain the importance of conducting linearity tests on radiographic equipment. What guidelines should be followed to ensure the accuracy and reliability of these tests? Answer: linearity tests are crucial for ensuring that the output of a radiographic system is consistent across a range of exposure levels. According to the Canadian Standards Association (CSA) Standard N.3, the linearity test helps verify that the relationship between exposure and output remains constant, preventing underexposure or overexposure of images. To conduct a linearity test, the following steps should be adhered to: calibration. Use a calibrated dosimeter to measure the radiation output at various kilovolt peak (kVp) settings, typically covering the entire range used in clinical practice. Data collection. Record the output readings for each kVp setting. Ensure that the technique is consistent across tests, including positioning of the dosimeter and the duration of exposure. Analysis. Plot the output against the kVp settings on a graph. The resulting line should be straight. Deviations indicate a need for further investigation into the equipment's performance. Regular checks, quarterly or biannually, and immediate retesting after maintenance are advised to ensure compliance and reliability. Describe the various types of image artifacts encountered in CT imaging and the potential corrective measures for each type. Answer: in CT imaging, several artifacts can compromise image quality, including motion artifacts caused by patient movement during the scan. Correction: utilize shorter scan times and instruct patients to remain still. Motion correction algorithms may also be applied in post-processing. Beam hardening artifacts result from the varying attenuation of X-rays as they pass through different tissues, leading to dark bands or streaks. Correction: employ beam hardening correction algorithms, calibrate the scanner, or use appropriate filtration techniques during scanning. Ring artifacts occur due to malfunctioning detector elements appearing as concentric rings on the image. Correction: regularly check and maintain the detector arrays, recalibrate the system, and apply software corrections. Understanding these artifacts is essential for accurate diagnosis, as artifacts can lead to misinterpretations of clinical data. Mr. Thompson, a radiologic technologist, notices an increase in repeat imaging rates due to positioning errors in his department. He is tasked with analyzing the repeat rates and implementing improvement strategies. What steps should Mr. Thompson take to address this issue? Answer: to tackle the issue of increased repeat imaging rates due to positioning errors, Mr. Thompson should follow these steps. Data collection. Begin by conducting a thorough analysis of repeat imaging cases over the past 3 months. Record specific details regarding the reasons for repeats, categorizing them by type e.g., positioning errors, exposure errors. Root cause analysis. Identify patterns or common factors contributing to the positioning errors. This might involve assessing the training levels of staff, reviewing standard operating procedures, and observing the imaging process. Education and training. Based on the findings, organize targeted training sessions for staff focusing on proper positioning techniques. Utilize visual aids and simulations to enhance understanding. Standard operating procedures (SOP). Revise and reinforce SOPs related to patient positioning. Develop checklists that technologists can reference before imaging. Quality control measures. Implement a peer review system where technologists review each other's work, providing constructive feedback. Follow-up assessment. After implementing these strategies, Mr. Thompson should reassess the repeat imaging rates over the following quarter to evaluate the effectiveness of the measures taken. By taking a systematic approach, Mr. Thompson can significantly reduce repeat imaging rates and enhance overall image quality. Discuss the significance of repeat analysis programs in radiologic practices. What key components should be included in an effective repeat analysis program? Answer: repeat analysis programs play a vital role in maintaining quality control in radiologic practices. Their significance lies in identifying and mitigating factors that lead to repeat imaging, thereby reducing unnecessary radiation exposure to patients and improving the efficiency of imaging departments. Key components of an effective repeat analysis program should include data collection. Establish a system for recording reasons for repeat images, including specific details like the type of error, modality, and patient demographics. Regular reviews. Schedule monthly or quarterly reviews of the collected data to identify trends and areas for improvement. Feedback mechanisms. Provide feedback to staff regarding their performance and the outcomes of repeat analyses. This could include individual performance reviews or departmental summaries. Action plans. Develop targeted action plans based on analysis results, which could involve additional training, revising protocols, or enhancing equipment maintenance practices. Documentation and reporting. Maintain thorough documentation of repeat cases and corrective actions taken and report findings to management for accountability and ongoing quality improvement. Patient safety emphasis. Educate staff on the importance of minimizing repeat imaging to ensure patient safety, reinforcing the ethical responsibility of radiologic technologists. By implementing these components, radiologic departments can improve their image quality and patient safety. Explain the role of preventive maintenance in imaging equipment. What protocols should be established to ensure effective preventive maintenance practices? Answer. Preventive maintenance is essential in ensuring that imaging equipment operates efficiently, minimizing downtime and reducing the risk of equipment failure. It directly impacts the quality of imaging services and patient safety. Protocols for effective preventive maintenance should include routine checks, schedule regular inspections of imaging equipment, e.g., weekly, monthly, to check for any visible signs of wear or malfunction. This includes cleaning components, checking cables, and ensuring calibration standards are met. Calibration procedures. Establish a routine calibration schedule for all imaging modalities following manufacturer recommendations and applicable guidelines, e.g., Health Canada's radiation emitting devices regulations. Calibration should be documented and include results for verification, log maintenance activities. Keep detailed logs of all maintenance activities performed, including dates, actions taken, and personnel involved. This documentation aids in tracking performance over time and is crucial for regulatory compliance. Staff training. Train staff on the importance of preventive maintenance and ensure they understand how to identify potential issues with equipment. Manufacturer guidelines. Follow manufacturer guidelines for maintenance schedules and specific maintenance tasks, as these are designed to ensure optimal performance and safety. Emergency protocols. Develop protocols for responding to equipment malfunctions, ensuring that there are immediate steps to mitigate risks and resume operations. By adhering to these protocols, imaging facilities can enhance the longevity and performance of their equipment. What are the key elements of image evaluation in radiography? Describe the role of quality assurance in maintaining high standards of image quality. Answer. Image evaluation in radiography involves assessing various characteristics of radiographic images to ensure diagnostic quality. Key elements include contrast, the ability to distinguish between different tissue types, crucial for identifying abnormalities. Adjustments to exposure settings can enhance contrast. Spatial resolution refers to the clarity and detail of structures within the image. High spatial resolution is essential for accurate diagnosis. Techniques like using appropriate filters and collimation can improve resolution. Noise, the presence of random variations in image brightness or color, which can obscure details. Strategies to minimize noise include optimizing exposure settings and using noise reduction algorithms. Quality assurance. CAR is critical in maintaining high standards of image quality. QA involves systematic monitoring and evaluation of imaging processes and outcomes. It includes regular performance audits, assessing imaging techniques and outcomes against established standards, staff training programs, educating staff on the importance of quality assurance measures, incident reporting systems, establishing protocols for reporting and analyzing imaging errors or quality issues, ensuring continual improvement. Through robust quality assurance practices, imaging departments can ensure consistent, high-quality images that facilitate accurate diagnosis. Why is preventive maintenance crucial for imaging equipment, and what best practices should be implemented to ensure compliance with safety regulations? Answer. Preventive maintenance is essential for imaging equipment to ensure its safe and effective operation, extend its lifespan, and reduce the risk of equipment failure, which can compromise patient care. Key reasons for its importance include safety. Regular maintenance helps prevent accidents and ensures that equipment complies with safety regulations, such as those outlined in Health Canada's radiation emitting devices regulations. Performance optimization. Routine checks and calibrations help maintain optimal imaging performance, leading to higher quality images and reduced repeat rates. Cost efficiency. By identifying potential issues early, preventive maintenance can help avoid costly repairs and downtime. Best practices for implementing effective preventive maintenance include developing a maintenance schedule, create a timeline for routine checks, calibration, and servicing based on manufacturer recommendations. Training staff. Ensure that all personnel are trained in proper maintenance techniques and understand the importance of adherence to safety standards. Identify and explain the significance of reproducibility tests in quality control for radiographic equipment. What are the steps involved in performing these tests? Answer: reproducibility tests are critical in quality control for radiographic equipment, ensuring that repeated exposures yield consistent results. The significance of these tests lies in their ability to establish confidence. High reproducibility instills confidence in the imaging process, essential for accurate diagnosis and treatment planning. Identify equipment issues. Variability in results may indicate underlying issues with equipment performance or calibration. To perform reproducibility tests, the following steps should be taken. Select parameters. Choose specific exposure settings (kVp) mass that will be tested for reproducibility. Conduct multiple exposures. Use a standardized protocol to take a series of images using the same exposure settings. Measure output. Analyze the images using a calibrated dosimeter or imaging analysis software to measure and compare the output intensity or density. Statistical analysis. Calculate the mean and standard deviation of the measurements. High consistency will show a low standard deviation, indicating good reproducibility. What are the primary causes of image artifacts in ultrasound imaging, and what corrective actions can be taken to mitigate these artifacts? Answer: in ultrasound imaging, various artifacts can affect image quality, primarily caused by limitations in the imaging system or patient factors. Common causes include reverberation artifacts, occur due to multiple reflections between the transducer and tissue interfaces, leading to echoes that appear as multiple equally spaced lines. Correction: just the angle of the ultrasound beam, or apply software filters to reduce the effect of reverberation. Shadowing artifacts result from the attenuation of sound waves by dense structures, causing a lack of echoes in the areas behind the structures. Correction: adjusting the gain settings or utilizing harmonic imaging can help visualize structures obscured by shadowing. Enhancement artifacts caused by an increase in echo amplitude in fluid-filled structures, leading to bright areas behind them. Correction: recognize these artifacts and adjust imaging techniques accordingly, such as using different frequency probes to mitigate the enhancement effect. How can the implementation of a repeat analysis program contribute to quality improvement in a radiology department? Discuss its components and effectiveness in reducing patient exposure. Answer: implementing a repeat analysis program is crucial for quality improvement in a radiology department. It systematically tracks the reasons for repeat imaging, facilitating continuous enhancement of imaging practices. Components of a repeat analysis program: data collection. Establish a robust system for capturing data on repeat images, including reasons for repeats, types of examinations, and staff involved. Trend analysis. Regularly review collected data to identify trends or patterns in repeat rates, which can inform targeted interventions. Feedback loop. Create a feedback mechanism where staff is informed about repeat rates and encouraged to participate in quality improvement efforts. Staff training. Provide ongoing education to technologists on best practices to minimize repeat rates, focusing on positioning, exposure settings, and equipment usage. Effectiveness in reducing patient exposure. By identifying and addressing the root causes of repeat imaging, a repeat analysis program can significantly reduce unnecessary radiation exposure to patients. Improved practices lead to more accurate imaging, thereby enhancing patient safety and increasing the overall efficiency of the radiology department. In conclusion, the comprehensive implementation of a repeat analysis program fosters a culture of continuous improvement, ultimately benefiting both patients and healthcare providers. What is the ALAR8 principle in radiation protection, and how is it applied in medical imaging practices? Answer: the ALAR8 principle stands for as low as reasonably achievable. It is a fundamental concept in radiation protection that aims to minimize radiation exposure to patients, staff, and the public, while ensuring that the medical benefits of diagnostic imaging outweigh the risks associated with radiation exposure. Application in medical imaging practices. Optimizing equipment settings. Radiologic technologists should adjust imaging parameters, e.g., kVp mass, to achieve the necessary image quality while minimizing radiation dose. This includes utilizing automatic exposure control systems where available, use of shielding, protective shielding, e.g., lead aprons. Thyroid shields should be utilized to protect sensitive organs and tissues from unnecessary radiation during imaging procedures. Limiting exposure time. Minimizing the duration of exposure when performing imaging studies helps reduce the overall dose received by the patient and healthcare providers. Collimation. Focusing the X-ray beam to the area of interest reduces the radiation exposure to surrounding tissues, thereby adhering to the ALARA principle. Patient education and communication. Informing patients about the risks and benefits of imaging procedures encourages informed decision-making and compliance, helping to ensure that imaging is conducted only when clinically justified. By implementing the ALARA principle in medical imaging, healthcare providers can enhance patient safety while still delivering effective diagnostic care. Compare digital radiography doctor to traditional film-based radiography, highlighting the advantages of DR. Answer: digital radiography doctor and traditional film-based radiography CR are both imaging techniques used to produce radiographs, but they differ significantly in technology, workflow, and image quality. Key differences: image acquisition. Digital radiography doctor utilizes digital detectors that convert X-ray photons directly into digital images. These detectors can be flat panel or indirect detectors that use scintillators. Traditional film-based radiography involves exposing radiographic film to X-rays, which then undergoes a chemical processing phase to produce visible images. Image processing doctor digital images can be processed instantly using computer software. Adjustments to contrast, brightness, and zoom can be made without the need for re-exposure. Film-based requires chemical processing, which can be time-consuming and limits the ability to manipulate the image post-exposure. Image quality doctor generally provides superior image quality with greater detail and contrast resolution. The ability to manipulate images digitally allows for improved diagnostic capabilities. Film-based image quality is dependent on film processing, and it is less forgiving of exposure errors. Radiation dose doctor often requires low radiation doses compared to film-based techniques due to the increased sensitivity of digital detectors. Film-based typically requires higher doses to achieve diagnostic quality images. Storage and archiving doctor digital images can be easily stored, transmitted, and retrieved using picture archiving and communication systems, PACS, improving accessibility and reducing physical storage space. Film-based requires physical storage of films, which can consume significant space and may lead to degradation over time. Advantages of digital radiography: faster image acquisition, immediate availability of images allows for quicker diagnosis and treatment. Improved image quality, enhanced contrast and detail aid in accurate diagnosis. Reduced radiation exposure, greater sensitivity reduces the need for high doses of radiation. Efficiency in workflow, streamlined processes improve the overall efficiency of imaging departments. Overall, digital radiography represents a significant advancement in imaging technology, leading to improved patient care and operational efficiency in medical facilities. Identify key agencies involved in radiation safety regulation and describe the standards they establish for medical imaging. Answer: several key agencies play crucial roles in establishing and enforcing radiation safety regulations for medical imaging. U.S. Food and Drug Administration (FDA). The FDA regulates the manufacturing and performance of medical imaging devices, ensuring the equipment meets safety standards and is effective for patient use. They set performance standards for X-ray equipment and monitor compliance through inspections. National Council on Radiation Protection and Measurements (NCRP). The NCRP provides recommendations on radiation protection standards based on scientific research. They develop guidelines for occupational exposure limits, patient safety, and the ALARA principle. American College of Radiology (ACA). The ACR collaborates with the Radiological Society of North America (RSNAE) to create practice guidelines and technical standards for imaging procedures. Their standards ensure that imaging practices are safe, effective, and consistent with the latest evidence. International Atomic Energy Agency (IAEA). The IAEA sets international safety standards and guidelines for radiation protection in medical applications. Their focus includes patient safety, staff protection, and regulatory frameworks to ensure safe practices globally. Environmental Protection Agency (EPA). The PA oversees environmental aspects of radiation safety and sets limits on radioactive emissions from medical facilities. They ensure that public exposure to radiation from medical practices is within safe limits. Standards established. Dose limits. Agencies establish permissible dose limits for patients and healthcare workers to minimize radiation exposure. Quality assurance programs. Recommendations for implementing quality control measures in imaging departments to ensure consistent image quality and equipment performance. Education and training. standards for the training and certification of personnel involved in medical imaging to ensure they are knowledgeable about radiation safety practices. Through collaboration and regulation, these agencies work to promote safe and effective practices in medical imaging, protecting patients and healthcare professionals from unnecessary radiation exposure. Explain the fundamental principles of computed tomography (CT) and discuss recent innovations that have enhanced its capabilities. Answer: computed tomography (CT) is a medical imaging technique that utilizes X-rays and computer processing to create cross-sectional images of the body. The fundamental principles include X-ray tube and detectors. A rotating X-ray tube emits X-rays from different angles as it moves around the patient. Detectors positioned opposite the tube capture the X-rays that pass through the body. Data acquisition. As the X-ray tube rotates, it collects data from multiple angles. This data is transmitted to a computer for reconstruction. Image reconstruction. The collected data is processed using algorithms, typically filter back projection or iterative reconstruction, to create detailed cross-sectional images, slices of the body. 3D reconstruction. Advanced algorithms can reconstruct images into three-dimensional representations, providing a comprehensive view of anatomical structures. Recent innovations. Dual energy CT DECT. This technology uses two different X-ray energy levels to enhance tissue characterization and improve the differentiation of materials, aiding in the diagnosis of conditions like kidney stones and vascular diseases. Iterative reconstruction techniques. New algorithms improve image quality while reducing radiation dose by allowing for lower exposure levels during scans. These techniques enhance noise reduction and detail in images. Wide-angle detectors. Innovations in detector technology have enabled the development of wide-angle detectors, which allow for faster image acquisition and improved coverage of larger anatomical areas. Real-time CT imaging. Advancements in CT technology enable real-time imaging capabilities, which can assist in guiding interventional procedures such as biopsies or catheter placements. Artificial intelligence (AI) integration. AI algorithms are increasingly being integrated into CT systems to assist with image analysis, automate workflows, and enhance diagnostic accuracy by detecting abnormalities that may be overlooked by human observers. Discuss the considerations for conducting imaging procedures on pediatric patients, particularly regarding their unique physiological and psychological needs. Answer: when conducting imaging procedures on pediatric patients, several considerations must be addressed. Radiation dose. Children are more sensitive to radiation than adults due to their developing tissues. Use pediatric-specific protocols to minimize radiation exposure while ensuring diagnostic quality. Age-appropriate communication. Tailor communication strategies to the child's age and developmental level. Use simple language and engaging explanations to help alleviate fears and anxiety. Parental involvement. Involve parents or guardians in the process, as their presence can provide comfort to the child. Discuss the procedure with them and encourage them to support their child during the imaging process. Distraction techniques. Employ distraction methods such as toys, videos, or games to help keep the child calm and engaged during the procedure. Use of immobilization. Use appropriate immobilization devices to help keep the child still during the procedure, reducing motion artifacts and the need for repeat imaging. Post-procedure considerations. Provide parents with post-procedure instructions and reassurances, as well as information on what to expect. What are the key differences between conventional radiography and digital radiography in terms of image acquisition and processing? Answer: the key differences between conventional radiography and digital radiography include image acquisition. Conventional radiography uses film-based systems where X-ray exposure creates a latent image on film that requires chemical processing to develop. Digital radiography utilizes digital detectors, either flat panel or computed radiography systems, to directly capture and convert X-rays into digital signals for immediate image display. Image processing. Conventional radiography requires manual processing of film in dark rooms, which can lead to delays in image availability and requires adherence to strict chemical handling protocols. Digital radiography provides immediate access to images on a computer screen, allowing for rapid evaluation and analysis. Post-processing capabilities, e.g., adjustments to contrast, brightness, can enhance image quality without the need for re-exposure. Storage and transmission. Conventional radiography requires physical storage of films, which can take up space and be susceptible to damage. Digital radiography enables efficient electronic storage and easy sharing of images between healthcare providers, facilitating collaboration and enhancing patient care. Image quality and dose. Conventional radiography film has a limited dynamic range which can affect image quality under varying exposure conditions. Digital radiography offers a broader dynamic range, providing higher quality images with potentially lower radiation doses due to enhanced sensitivity of digital detectors. Relevant guideline. The Radiological Society of North America (RSNI) outlines the advantages of digital radiography over conventional methods, particularly in terms of efficiency, image quality, and patient safety. Describe the role of a radiologic technologist in the interventional radiology suite and the specific skills required for this setting. Answer. The role of a radiologic technologist in the interventional radiology suite includes technical expertise, operate advanced imaging equipment, e.g. fluoroscopy, ultrasound, to provide real-time imaging during interventional procedures, ensuring optimal visualization for the physician. Patient preparation. Prepare patients for interventional procedures by explaining the process, obtaining informed consent, and ensuring proper positioning and sedation protocols are followed. Collaboration with physicians. Work closely with interventional radiologists and other medical staff to assist during procedures, ensuring the necessary equipment is available and ready for use. Monitoring patient safety. Monitor the patient's vital signs and comfort levels during procedures, being vigilant for any signs of complications or adverse reactions. Record keeping. Document procedures accurately, including the type and amount of contrast media used, patient response, and any complications that arise. Infection control. Adhere to strict infection control protocols to prevent complications and ensure patient safety, particularly in sterile environments. Skills required. Proficiency in operating imaging equipment and understanding complex imaging protocols. Strong communication skills to effectively interact with patients and the medical team. Attention to detail and the ability to perform under pressure during complex procedures. Knowledge of anatomy, pathology, and interventional techniques relevant to specific procedures. Relevant guideline. The Society of Interventional Radiology provides guidelines outlining the roles and responsibilities of radiologic technologists in interventional radiology settings, emphasizing the importance of training and expertise. What protocols should be established in a radiology department to manage incidents involving radiation exposure to staff or patients? Answer. Establishing protocols for managing incidents involving radiation exposure is essential for ensuring the safety of both staff and patients. Key components of these protocols include immediate response. Have clear procedures in place for immediate response, including stopping the procedure and ensuring the affected individual is removed from exposure. Assessment and documentation. Conduct a thorough assessment of the incident, documenting all relevant details such as the dose received, the circumstances of the exposure, and any injuries. Medical evaluation. Ensure that affected individuals receive prompt medical evaluation and follow-up care as necessary. Incident reporting. Implement a system for reporting incidents to the appropriate regulatory bodies as required by CNSC regulations. Training and drills. Regularly train staff on emergency procedures and conduct drills to prepare for potential exposure incidents. These protocols help mitigate the risks associated with radiation exposure and promote a culture of safety within the department. What is the role of the Radiation Safety Officer (RSO) in a radiology department, and what responsibilities do they hold in maintaining safety standards? Answer. The Radiation Safety Officer (RSO) plays a critical role in overseeing the safe use of radiation in a radiology department. Key responsibilities include regulatory compliance, ensuring that the department complies with all applicable regulations and guidelines set forth by the CNSC and Health Canada. Monitoring exposure, overseeing personnel monitoring programs to track radiation exposure levels of staff and ensure compliance with dose limits. Safety training, providing training and education to staff regarding radiation safety practices and emergency procedures. Incident investigation, investigating any incidents of overexposure or safety breaches and implementing corrective actions. Policy development, developing and updating radiation safety policies and protocols to reflect current practices and regulatory requirements. The RSO serves as a vital resource for ensuring a culture of safety and minimizing the risks associated with radiation exposure in the department. What impact do advancements in radiology technology, such as AI and machine learning, have on radiation safety and patient care? Answer: advancements in radiology technology, particularly in artificial intelligence, AI, and machine learning, have significant implications for radiation safety and patient care, including enhanced image interpretation. AI can assist in accurately interpreting images, potentially reducing the need for repeat imaging and thus lowering overall patient exposure. Dose optimization. Machine learning algorithms can analyze imaging protocols and adjust radiation doses based on patient-specific factors, ensuring minimal exposure while maintaining image quality. Predictive analytics. AI can predict patient outcomes and identify individuals at higher risk for radiation-related complications, allowing for targeted monitoring and interventions. Workflow efficiency. Automation of administrative tasks and image processing reduces the time staff spend in high radiation areas, indirectly lowering their exposure. Overall, these advancements contribute to improving patient safety, enhancing the quality of care, and fostering a more efficient and effective radiology practice. Explain the principles and applications of digital subtraction angiography (DSA) in vascular imaging. Answer: digital subtraction angiography (DSA) is a specialized imaging technique used to visualize blood vessels by subtracting pre-contrast images from post-contrast images. Principles of DSA: DSA involves the acquisition of two sets of images, a non-contrast mask image and a contrast-enhanced image. The mask image captures the baseline anatomy without any contrast media. When the contrast media is introduced, a second image is taken. The DSA software subtracts the mask image from the contrast image, effectively removing the overlying structures and highlighting the blood vessels. Applications: DSA is primarily used in interventional radiology for diagnostic and therapeutic purposes. It is instrumental in identifying vascular abnormalities such as stenosis, aneurysms, and vascular malformations. DSA allows for precise localization of lesions and aids in guiding interventions like angioplasty or stent placement. Advantages: DSA provides high-resolution images of the vascular system with enhanced visualization of vessels, leading to improved diagnostic accuracy and treatment outcomes. Additionally, it minimizes the amount of contrast agent needed and reduces the radiation dose compared to conventional angiography. Discuss the role of computed tomography (CT) in the evaluation of trauma patients and the specific protocols used in such cases. Answer: computed tomography (CT) plays a critical role in the rapid assessment of trauma patients, providing detailed cross-sectional images that aid in the diagnosis of injuries. Role in trauma evaluation: CT is particularly useful in evaluating head, chest, abdomen, and pelvic injuries. Its speed and accuracy allow for quick diagnosis, which is crucial in life-threatening situations. CT can identify fractures, internal bleeding, organ lacerations, and other traumatic injuries that may not be visible on X-rays. Protocols used: in trauma cases, specific CT protocols are implemented to ensure comprehensive evaluation. Head CT focuses on detecting intracranial hemorrhages, skull fractures, and brain injuries, typically performed without contrast unless there are indications of vascular injuries. Chest CT utilized to assess lung contusions, pneumothorax, hemothorax, and major vascular injuries. Intravenous Roman contrast is often used for enhanced visualization of blood vessels. Abdominal and pelvic CT or multi-phase approach may be used, including non-contrast, arterial, and venous phases to evaluate for solid organ injuries, vascular injuries, and free fluid or air. CT angiography. This specialized CT protocol is employed when vascular injuries are suspected, allowing for the visualization of blood vessels using contrast. By implementing these protocols, CT enhances the overall management of trauma patients, facilitating timely interventions and improving outcomes. During a fluoroscopy procedure, Technologist MS, Rodriguez notices increased patient exposure times due to the complexity of the procedure. What strategies can she implement to minimize radiation exposure while maintaining image quality? Answer: to minimize radiation exposure during fluoroscopy procedures while maintaining image quality MS, Rodriguez can implement the following strategies: optimization of fluoroscopy settings. Adjusting the fluoroscopy machine settings, such as reducing the pulse rate and using the lowest acceptable frame rate, can help decrease the radiation dose while maintaining necessary image quality. Use of pulsed fluoroscopy. Employing pulsed fluoroscopy instead of continuous fluoroscopy significantly reduces the radiation dose by providing intermittent images rather than a continuous stream. Collimation MS. Rodriguez should use collimation to limit the radiation beam to the area of interest, reducing exposure to surrounding tissues and minimizing scatter radiation. Lead shields. Utilizing lead aprons or shields can protect sensitive areas of the patient's body from unnecessary radiation exposure. Patient positioning. Properly positioning the patient can facilitate optimal visualization of the area of interest, potentially reducing the need for repeat exposures. Education and communication. Ensuring the patient understands the procedure can help them remain still and cooperate, reducing the need for prolonged fluoroscopy. Describe the interaction of X-rays with matter and the three primary mechanisms of interaction. Answer: the interaction of X-rays with matter is crucial in medical imaging as it determines how X-rays are absorbed, scattered, or transmitted through tissues. The three primary mechanisms of X-ray interaction with matter are photoelectric effect. Description: this occurs when an X-ray photon is completely absorbed by an inner shell electron of an atom, resulting in the ejection of the electron from the atom. The photon must have energy greater than the binding energy of the electron. Significance: the photoelectric effect is more probable in tissues with higher atomic numbers, e.g., bone, and low photon energies. It contributes significantly to image contrast as denser tissues absorb more photons, resulting in darker areas on the image. Compton scattering. Description: in this mechanism, an X-ray photon collides with an outer shell electron, imparting some of its energy to the electron and scattering it. A lower energy, the ejected electron, can cause further ionization in surrounding tissues. Significance: Compton scattering is predominant in soft tissues and is responsible for the scatter radiation that can degrade image quality. It is also the primary interaction mechanism at higher X-ray energies, such as those used in diagnostic radiology. Rayleigh scattering. Description: Rayleigh scattering occurs when X-ray photons are elastically scattered by atoms without any energy loss. This interaction is more significant at lower energies and with larger structures. Significance: while Rayleigh scattering contributes less to image formation compared to photoelectric absorption and Compton scattering, it can still affect image quality by contributing to scatter, particularly in thick or dense materials. Understanding these interactions helps radiologic technologists optimize imaging techniques to achieve the best possible diagnostic quality while minimizing patient exposure. What are the key components of a quality assurance CAR program in radiology? Why is it essential? Answer: a quality assurance CART program in radiology is designed to ensure that imaging systems operate optimally, producing high-quality images while maintaining patient safety. Key components of a QA program include equipment calibration and maintenance. Regular calibration of imaging equipment, such as X-ray machines, is essential to ensure accurate dose delivery and image quality. Routine maintenance schedules should be followed to address any equipment malfunctions. Image quality evaluation. This involves assessing the diagnostic quality of images produced through phantom studies, which simulate human tissue. Parameters such as contrast, resolution, and noise are evaluated to ensure they meet established standards. Radiation dose monitoring. Monitoring and recording radiation doses delivered to patients during imaging procedures help ensure compliance with established dose limits and ALARA principles. This data can also identify trends that may indicate equipment issues or procedural changes. Staff training and competence. Ongoing education and training for radiologic technologists and other staff are crucial for maintaining high standards of practice and ensuring they are familiar with new technologies and safety protocols. Patient feedback and incident reporting. A system for collecting patient feedback and reporting incidents or near misses promotes a culture of safety and improvement. Analyzing this feedback can lead to changes that enhance patient care and safety. Importance. A robust QA program is essential for ensuring the safety and effectiveness of radiologic services. It helps in identifying potential issues before they affect patient care, maintains compliance with regulatory standards, and enhances overall patient satisfaction by providing high-quality diagnostic services. Discuss the potential risks of radiation exposure during pregnancy and the guidelines for imaging pregnant patients. Answer: radiation exposure during pregnancy poses potential risks to the developing fetus, including an increased risk of congenital abnormalities and cancer. The following outlines the risks and guidelines for imaging pregnant patients. Potential risks: teratogenic effects. High doses of radiation during the first trimester when organogenesis occurs may lead to developmental abnormalities or malformations. Increased cancer risk. Studies suggest that fetal exposure to ionizing radiation can increase the risk of childhood cancers such as leukemia, particularly if exposure occurs during critical periods of development. Guidelines for imaging pregnant patients. Assess necessity. Before conducting any imaging, healthcare providers should evaluate the necessity of the procedure and consider alternatives that do not involve ionizing radiation, e.g., ultrasound or MURA. Use lowest possible dose. If X-ray imaging is required, practitioners should utilize techniques that minimize fetal exposure, such as using lead shielding, e.g., a lead apron over the abdomen and pelvis, and optimizing the imaging protocol to use the lowest effective dose. Timing of imaging. Whenever possible, non-emergency imaging should be postponed until after the first trimester, when the risk of teratogenic effects is highest. Informed consent. Pregnant patients should be informed about the potential risks associated with radiation exposure and alternatives available, allowing them to make informed decisions regarding their care. By adhering to these guidelines, healthcare providers can manage the risks associated with radiation exposure in pregnant patients while still providing necessary diagnostic care. Explain the concept of cellular repair mechanisms in the context of radiobiology. How do these mechanisms influence radiosensitivity in different tissues? Answer. Cellular repair mechanisms are critical processes that enable cells to recover from radiation-induced damage. These mechanisms can be broadly categorized into suborbital damage repair. This involves the repair of DNA damage that does not result in cell death. Following radiation exposure, cells may sustain various types of DNA damage, such as single-strand breaks (SSBS) and double-strand break (DSBS). Enzymatic pathways, including the homologous recombination and non-homologous end joining, play a crucial role in repairing DSBS. Effective repair of suborbital damage can lead to cell survival and proliferation. Potentially lethal damage repair. This refers to damage that, if not repaired, can lead to cell death. Cells may have the capability to repair this type of damage under certain conditions, e.g. when exposed to low doses of radiation over time. Influence on radiosensitivity. The efficiency of cellular repair mechanisms significantly impacts radiosensitivity. For instance, rapidly dividing cells, e.g. tumor cells, often have limited repair capabilities, making them more sensitive to radiation. Normal tissues like muscle and nerve cells, which divide less frequently, may possess more robust repair mechanisms, resulting in lower radiosensitivity. Factors influencing radiosensitivity. Cell cycle phase. Cells are generally more radiosensitive during the GM phase of the cell cycle, when they are preparing for division, as they are more susceptible to the effects of DNA damage. Oxygen effect. Oxygen enhances the effectiveness of radiation therapy by increasing the formation of reactive oxygen species, ROS, which further damage cellular components and overwhelm the repair mechanisms. Understanding these concepts is essential for optimizing radiation treatment plans, as clinicians can exploit the differences in radiosensitivity between various tissues to maximize tumor control while sparing healthy tissue. Discuss the mechanisms and implications of acute radiation syndrome (ARS) in medical radiation practice. What are the dose ranges associated with different types of ARS? Answer. Acute radiation syndrome (ARS) occurs following high doses of ionizing radiation, typically exceeding 1 Gi 100 rad, delivered over a short period. ARS is characterized by a series of clinical symptoms that arise due to damage to rapidly dividing tissues. The severity and type of symptoms depend on the dose received and the specific organ systems affected. Mechanisms of ARS. Hematopoietic system. High doses can lead to depletion of blood cell precursors in the bone marrow, resulting in bone marrow failure, anemia, thrombocytopenia, and increased susceptibility to infections. Gastrointestinal tract. Damage to the intestinal lining causes nausea, vomiting, diarrhea, and dehydration. This typically occurs at doses above 6 Gi. Central nervous system. Very high doses, generally above 30 Gi, can lead to severe neurological damage and are associated with a rapid onset of symptoms including confusion, loss of consciousness, and death. Dose ranges and syndromes. Hematopoietic syndrome occurs at doses of approximately 1. 6 Gi. Symptoms may take days to weeks to manifest. Gastrointestinal syndrome occurs at doses of 6. 30 Gi. Symptoms appear within hours, leading to severe dehydration and electrolyte imbalance. Cerebrovascular syndrome. At doses above 30 Gi, onset of symptoms is immediate and can lead to death within hours to days. Implications for medical radiation practice. Understanding ARS is crucial for medical professionals to implement appropriate safety protocols to prevent accidental exposure. Recognize the symptoms of ARS in exposed individuals. Provide timely and effective medical intervention, which may include supportive care and treatment for specific symptoms. In what ways can the concepts of stochastic and deterministic effects be applied to patient treatment plans in radiation therapy? Answer. Stochastic and deterministic effects are two fundamental categories of radiation effects that influence patient treatment plans in radiation therapy. Stochastic effects These effects, such as cancer induction and genetic mutations, arise from the probabilistic nature of radiation exposure. They do not have a threshold dose, hence any exposure, no matter how small, carries some risk. Key considerations include long-term risk assessment. Treatment plans must account for the cumulative dose received by patients, especially in protocols involving multiple treatments over time. This includes assessing the lifetime risk of secondary malignancies based on dose-response models. ALARA principle. Treatment plans are designed to minimize doses to non-target tissues, thereby reducing the risk of stochastic effects. Deterministic effects. These effects, such as skin erythema or organ dysfunction, have a clear threshold. Above this threshold, the severity of the effect increases with dose. Key considerations include threshold determination. Clinicians must establish dose limits to avoid deterministic effects during treatment planning, for instance, ensuring that doses do not exceed levels known to cause skin reactions or damage to organs at risk. Or dose fractionation. Treatment plans often involve fractionating the total dose over several sessions to allow normal tissues time to recover, thus mitigating the risk of deterministic effects. Clinical application. In practice, clinicians utilize these concepts to design individualized treatment regimens that balance the need for effective tumor control, targeting stochastic effects, while minimizing the risk of acute and chronic side effects, avoiding deterministic effects. Use imaging techniques to accurately assess tumor volume and surrounding structures, allowing for precision in dose delivery. By integrating the understanding of stochastic and deterministic effects, healthcare providers can enhance treatment outcomes while prioritizing patient safety and quality of life. Define and differentiate between deterministic and stochastic effects of radiation exposure in medical imaging. Answer: deterministic and stochastic effects are two categories of radiation effects that arise from exposure to ionizing radiation, including that from medical imaging. Deterministic effects. These effects are predictable and occur after certain threshold doses reached. Deterministic effects include tissue damage that results in observable symptoms, such as skin burns, cataracts, or radiation sickness. The severity of the effect is directly related to the dose received. At higher doses lead to more severe effects. In medical imaging, the goal is to keep radiation exposure below the threshold to prevent these effects. Stochastic effects. Unlike deterministic effects, stochastic effects occur by chance and do not have a threshold dose. These effects are probabilistic in nature, meaning the likelihood of occurrence increases with dose, but the severity of the effect is independent of the dose. Examples include cancer and genetic mutations. In medical imaging, minimizing exposure is crucial to reduce the risk of stochastic effects even at low doses. In summary, deterministic effects are dose-dependent and have a threshold, while stochastic effects are probabilistic and do not have a threshold. Understanding these concepts is essential for radiation safety and effective patient care in medical imaging.